Dorga. So we here at our outpatient clinic got a brand new piece of equipment. This is an ultrasound machine. Are you familiar with how to use an ultrasound machine?
No, I was not allowed to do ultrasound in my old practice.
You weren't? Where did you work?
In Illinois.
Oh, okay. So here in Indiana, you are allowed in your scope of practice to do modalities. So I am going to teach you how to use this new piece of equipment that we have here. I will give you a quick rundown. We also have this ultrasound handout that we give to everybody in our department, just to sort of like, it goes through like what all of the terms mean in regards to ultrasound and things like that. And then there's also a checklist here on this other page, and we're going to do a skills checkout next week, so we'll give you a week to like learn how to use everything and get familiar with the equipment, and then we'll do a skills checkout next week. Okay?
Okay.
So there are a few things. We'll do a quick rundown really quick. You're going to want to make sure that you have a towel for the patient. This is the ultrasound wand. There's a few different sizes, so that's part of using the ultrasound machine, is making sure you select the right wand size. And then this one here is sort of touch screen. So there's a few different things that you have to do. You have to make sure that the machine is plugged in. So we have it plugged into the wall over here. We want to make sure that it's on. So the screen will light up when it's turned on. You want to make sure that after you select the wand size, and there's a little bit of information on your handout about this, but you want to make sure that the wand is plugged in. This would be a good wand to use maybe on like an arm or like a knee or something like that. We have one that's smaller that you can use for like hands and fingers and wrists. And then we have one that's even bigger than this that would be good if you're using it on like a bigger body part. But all that information is on your checklist.
Okay.
So you're going to want to make sure that it's plugged in, and then you're going to want to make sure that it is on the ultrasound capability, because this machine is also able to do other things as well. So we want to make sure that it's on ultrasound, and you're going to want to make sure that you're using, one of the most important things is that you're using the right frequency.
Okay.
So there is 1 megahertz and 2 megahertz and 3 megahertz. And the 1 megahertz is for really deep lesions. So like if it's like a big part of the body and you want to make sure that the ultrasound is going really deep, you're going to use 1. 2 is for like moderate depth, and then 3 is for superficial wounds. And again, all that's outlined on your checklist. The ultrasound, just sort of in general, is a heat modality that we use to work on tissue extensibility and to relieve pain and for scar healing and stuff like that. So again, make sure you go through your handout and then get familiar with the equipment. If you have any questions or anything, I want you to come talk to me. Don't just be like trying it on people unsafely. We don't want that.
Okay.
Okay. Do you have any questions?
No.
Okay, Dorga. So a few more questions for your skills checkup. Is this wand the appropriate size to be using if you're working on someone's wrist?
No, I would probably use the smaller wand.
Okay, good. And then, what do you need to make sure is on the patient's body before you are touching the wand to their skin?
The gel, the ultrasound gel.
That is right. Okay, and then, if you were doing ultrasound with the smaller wand, like you said, on someone's wrist for a superficial injury, would you do 1 megahertz, 2 megahertz, or 3 megahertz?
I would do 3 since it's superficial.
Good. Great job. You passed your skills checkout.
Thank you.